Hi. In this short video, we will quickly discuss about what the ideal age to start foods for the baby is apart from milk. So we call this complementary feeding or weaning, and whether the baby is breastfeeding exclusively or is on breast and formula feeds or formula feeds alone, you do consider starting solids by 6 months of age in all babies. There is a group of babies where you may consider starting solids around 4 to 6 months of age. You never start solids before 4 months of age. The baby is not ready for the digestion and so on, and the risk of allergy is more. Some studies have even shown that if you introduce solids before 4 months, you have a higher risk of obesity as well. So we don't introduce before 4 months, and all the babies should be having solids introduced by 6 months ideally, so that they don't reject, because the independence of the child starts setting up and they may start rejecting or refusing if you leave it too late. So try to start by 6 months in all the children. When you start between 4 and 6 months, the aim is not to replace the milk feeds, it's to start training them. So if you do decide to start by 4 to 6 months, it's acceptable by most of the European gastroenterology body and the American Nutrition Society and so on. So even though the World Health Organization says 6 months, you can consider starting by 4 to 6 months if you think the baby is ready, is showing keenness, but you don't hurry them through the stage. You introduce gradually. You start with 1 or 2 spoons of bland fruits and vegetables and progress with the cereals as the baby starts taking more. So the signs of readiness will be when the baby is looking at you when you're eating, is having a straight back and is able to sit on a high chair, for example, leaning forward. They show keenness to swallow. They're not pushing the spoon away with the tongue thrusting. And you don't need to be anxious if they don't progress. If they're growing well and the milk feed is adequate, there is no rush really to progress. So you wait and reintroduce when you think the baby is more ready as well. So the summarizing point here is that you have to start by 6 months in all babies. You consider starting early in some babies by 4 to 6 months, and it's a gradual process. You start with 1 or 2 times with small quantities, and then the milk is not reduced at this time. When the baby starts taking better, you progress. And some babies, like those with reflux and those who are not gaining weight well, or where the working mother has a reducing store of express milk and she doesn't want to use formula, these are situations where you may consider introducing weaning by 4 months as well. So I hope this is useful. Please do share. Thank you.